Do I get a good morning back? From Apollo Cancer Center, Hyderabad. And being a woman myself, I feel utterly proud to host this program that educates and empowers women in cancer well being. Before we delve into our program, let me once again welcome all our dignitaries, the press, and of course, our brigades. Now, talking about what is a Purple Clip Brigade. The campaign Together for Her, Be the Change, Be the Voice, Be the Change, Be the Voice is a unique kind of campaign that Apollo Cancer Center has initiated. That is to ensure that there's an empowerment to women to advocate for cancer today. The campaign Together for Her and Be the Voice, Be the Change is a unique and a one of a kind initiative that Apollo Cancer Center has initiated that to empower women to advocate for cancer. Today, we stand in our commitment to spread awareness, offer support, and to inspire hope. And Purple Clip Initiative symbolizes a personal commitment to women's health, much like clipping for protection and prevention. That is just like saying clipping it in the bud. And propagating this awareness and this initiative to every woman in our lifestyle requires a force that was spearheaded by 52 young and readily willing and enthusiastic students who was identified from 20 different colleges in Hyderabad city. They were trained on various aspects of women's health, precisely on cancer, like encourage regular screenings and emphasize on importance of early detections and many more. And in addition, they were also educated how to disseminate. So these students who were selected, 52 young spearheaded, were actually given training how to encourage people to do a regular screening and to emphasize the importance of early detection and more. And in addition, they have given the knowledge how to disseminate this knowledge to fellow women members in their livelihood, helping women to embark on this journey together, remembering that awareness is the first towards prevention and compassion is the cornerstone of support and helping every woman to clip it on time. Thus, India's first Purple Clip Brigade was formed. And I would request all of you to give a big round of applause to this 52 young women. Thank you to all of you. And every woman in here are champions of Purple Clip. And we take the oath of helping one another and who are leading the charge for change. Your engagement is vital in fostering a supportive environment where we can learn from one another and work towards a common goal that is being the voice and being the change. And with that, we will kickstart the program. We will start with a panel discussion on women's cancer awareness, followed by a Q&A session, and then lastly by the photo ops with Purple Clip Brigades and the dignitaries. And for the panel discussion, can I kindly request, formally let us welcome Dr. Sai Lakshmi Dayana, Consultant Surgical Gynec Oncologist, Apollo Cancer Center, Hyderabad. Followed by Dr. Pratima Kanumuri, Consultant Surgical Breast Oncologist, Apollo Cancer Center, Hyderabad. Ms. Swapna Saripalli, Head HR, Chubb Business Services, and Harvard alumnus. Dr. Christina Chongutu, IAS, Secretary to Government, Health, Medical and Family Welfare. Welcome, ma'am. Mr. Vijay Kumar, IPS, Additional Director General of Greyhounds and Octopus, Telangana Police. Thank you so much, sir. And of course, we do have our Dr. P. Vijay Anand Reddy, the Director, Apollo Cancer Center, Hyderabad. And he will be the moderator for the panel discussion.
A very good morning and a warm welcome to all of you. The hand that rocks the cradle rules the world. I repeat, the hand that rocks the cradle rules the world. Of course, these days, most of the men started rocking the cradle, but still, this statement holds good for the wonderful woman. I always feel that God's one of the wonderful creations are women. Every stage of woman's life is admirable and adorable. Right from sweet little child, a bubbly teenager, a loving wife, caring mother, and a blessing granny. Always, I feel proud to be associated with women groups, and I have no hesitation in saluting them. Hats off to you. Love, care, compassion, and selfless service are synonymous with womanhood. Mahatma once said, men cannot be equal to women in terms of selfless service. God has been partial to women in one more way. Most of the diseases, including cancer, are curable in women compared to all cancers in men. Not only that they are curable, but they show warning signs and symptoms much earlier in women compared to men cancers. So I'm sure God has showed this on women because we know and He knows that women are indispensable. So you deserve the best, and why you neglect yourself? Today we have gathered here to listen from the eminent personalities, achievers and opinion leaders what a woman should do to take care of herself and her family and the society around them, together for her. It is indeed great pleasure to welcome you all the dignitaries here and the students and the press for this initiative from Apollo Cancer Institute. To start with, may I ask Dr. Sai, what do you think the reasons that these cancers have significantly increased in the recent past?
So, the basics of any human or animal life is eating, sleeping, and physical intimacy or sexual intercourse. And going back to the basic roots, the way people eat and the amount of quality sleep they are getting, and the increase in sexual activity or sexual promiscuity is probably one of the reasons we are seeing a lot of cancers in humans and especially in women. As a gynecologist, I'm more focusing on the cervical cancer too. And we're seeing a lot of youngsters participating in sexual activity, premarital sex, and that is leading to HPV infections. And these same people are not paying attention to the quality, quantity of food, either too much or too little, and too many distractions to get good quality sleep.
Madam Christina, if I may ask you from your angle, not from the medical side, why the incidence of cancer is increasing day by day? Of late, in the last decade, from 6 lakh per year, it has gone up to 12 lakhs per year in our country.
I would say that definitely the impact of changing lifestyle has a big role to play. And as we are progressing, I mean, a lifestyle change has not necessarily been adapted to make us, more conscious about the better health choices that we have. And that is why I think one of the more important things when we talk about diseases which are non-communicable like cancer, we give a large focus on the role of information, education, and communication. Now, especially in the case of cancer, awareness and early detection is critical. Whereas I think when we have got a large advancement in science, technology, I mean, the kind of health facilities that we have are, much better as compared to, let us say, a few decades ago. But it is up to us to actually spread this message of awareness among the youth and among the upcoming generation so that we are conscious about the risks that we face and that we can make a better use of the advancements in healthcare so that, we can be aware of what could be a problem that would face us in the years to come, and that we can detect it at a very early stage, and that we can learn to manage our health in a better and a more sustainable fashion.
Thank you, ma'am. If I may ask you, Dr. Pratima, what could be the most common causes that we can get intervened and do something to protect ourselves from developing cancer?
Like everybody has already talked about the lifestyle changes that we are noticing, cultural changes that have happened recently. Some of them are modifiable and some of them are not. It's more the really the the few risks that we can actually modify is basically being eating healthy and really maintaining an ideal body weight and actually exercising regularly has really shown a lot of benefit in preventing cancer, as well as also avoiding recurrence or decreasing your chance of recurrence if you have already been diagnosed with cancer. So these things have been proven. Especially for breast cancer, alcohol consumption has really increases your risk of breast cancer. So that is a modifiable risk factor. Smoking also can increase it slightly, but we haven't seen as much as an association with breast cancer like we've seen with alcohol. The other thing that we have really seen a strong association is early, the number of ovulatory exposures our body goes through, because every time there's hormonal changes with our monthly periods, our breasts get affected. So if we have early menarche, late menopause, also using hormonal replacement after menopause, which, because of the symptoms that the women are experiencing, having children late, IVF treatments, and also, decrease in the number of pregnancies that we are seeing. All of these also increase your risk of breast cancer. So a lot of times, some of these things are not modifiable because, yes, there's a lot of change in our culture now. But it's important, our goal right now is to really improve awareness and really spread the right kind of knowledge and an openness and confidence to actually deal with the problem and use the facilities that we have and have access to care to really find the cancer early and actually get treatment in a timely fashion.
Right, Pratima. You nicely put it as modifiable and not modifiable. So, what are the modifiable things that we can be doing something by ourselves which we can prevent our cancer? As WHO pointed out, we are not worried about the epidemic of virus. We are more worried about the epidemic of smoking and chewing tobacco. So, that is a bigger killer. If you look at the incidence of deaths that happen in our country or across the globe, the biggest killer compared to any other reason is smoking and chewing tobacco. So if I may ask you, Ms. Christina, what is that we can do to, we know that it's a poison, but we are selling it freely. You heard about COPTA and how far the government is going to help us in implementing this COPTA. Especially the young children are getting exposed, available of smoking, chewing and tobacco near their schools and colleges.
I think that it's very clear that public policy often supports the concerns of the public at large, and acts like COPTA have been introduced, giving a lot of room and leeway to the states to make their own amendments and additionalities based upon the concerns that we face in our respective states. And recently, in this regard, I think the state of Telangana has also, amended and enhanced the scope of COPTA by also addressing the menace of hookah parlors and hookah bars, which was also done in a few states like Maharashtra, Tamil Nadu, and Karnataka. So I think that this kind of support that we have in terms of regulation is definitely critical in ensuring that there is some watch and ward on this menace of non-communicable diseases. And apart from that, like we say, everything cannot be regulated. It also is very critical that the public is aware about what is a norm and what is a rule and what is doable and what is not. So when the legal provisions are created, it is meant for the public to understand and to make better use of these provisions that are enacted, so that the vision of public policy is not just for the regulatory purview but also for a collective implementation. Now it's an individual choice whether one has to smoke or not to smoke, but there have been progressively a lot of decisions taken in government that we should protect the health of those who are not smoking, that there may be some taxes and there may be some surcharges levied on consumer goods that are found to have a detrimental effect on health. And these kind of things are meant to discourage the use of potentially harmful substances by the public. But overall, ultimately, we all know it's a consumer's market, and there has to be a lot of social consciousness and awareness. And in this regard, I'm very glad to note that, yes, the younger generations, we hardly find people who smoke. The incidence of people who smoke is definitely coming down as we see it. A lot of the youngsters are consciously making this choice. There have been a lot of IEC in theaters and in cigarette packets. There are these, rather grotesque and frightening images that are put. But ultimately, yes, the message has gone through to the youth. And I think we need to really stress on making our younger generation more aware of what are the harmful substances that are available, and which maybe, we need to be very cautious about, controlling, and about, ensuring that we do not partake of these harmful substances.
Well said, Ms. Christina. It's wonderful. It's ultimately boils down to social responsibility and self-discipline. So my question to you, Mr. Vijay Garu, pointing fingers at something which we can't do anything, talking about pollution, talking about pesticides all over, which actually are 2 to 3% cause reasons for developing cancer. There are far more self reasons that imbibed by ourselves, which are the reasons for developing cancer. What is your opinion on it?
As you rightly said, there are issues external which lead to rise in number of cases of cancer, and there is not much we can as individuals do about it. Governments of the day are doing their best. Societies are also chipping in as and when possible and to the extent possible. But there are a lot many things which we as individuals we can also do. I would like to break this into three components. A healthy or a happy mind or soul, a healthy or happy body, and then your immediate healthy environment. These three things are in your control, and I would little bit like to take away all of us to ancient, or not very ancient, but a traditional way of living, which was there in the Indian society. Uh, the Indian philosophy, the so-called Hindu philosophy, also speaks of dharma, arth, kam, and moksha. But they say that all this should be in equal proportion. So while you make a living, you make a living as per dharma, and you also enjoy that living. That is your calm. It's not only about sexual relationship, it's about all your desires. You fulfill all those in proportion by making money as per dharma. If you do that proportionally, you will attain nirvana. Nirvana, they say, is nothing else but being in a happy state. You don't have to go to other world to attain nirvana. So, uh, so this happy mind is a very, very important factor. It's not only for cancer, it's for overall well-being also. Happy body as well, and our immediate environment, which we can only impact. For example, uh, 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 in last 20 or 25 years, there has been a 180-degree change in a way that earlier we used to go to market to buy something, or you go to kitchen to get something, or you go out, or you have to go shopping, you have to go out. Now everything comes to you. So your body does not need to be mobile at all. You can be lying in your bed from morning to evening and spend the night there as well, and everything will come to you. Now, also, if you realize, all of us suffer from this cell phone syndrome, that like we sit in the back of the vehicle while the vehicle is moving. It's impossible not to touch the cell phone for me also for in 5 minutes. Just for the heck of it. I mean, there is nothing important. There will be no important messages to respond to or nothing. But cell phone to touch karna padega. So the mind is so overactive all the time. The body is so lethargic all the time, which actually should have been ulta. Your body should have been active like a farmer, and the mind should have been calm. So there has been a paradigm shift which probably affects all of us and probably affect the future generations more and more. So we have to have some kind of control on that and to bring back to a normal. Also, our immediate environment, that is our house, our neighborhood, and these things is what is in our control. We can take care of that. Thank you.
Thank you, Vijay. So all in all, we should understand that it's a self-discipline, and it's our responsibility to take care of ourselves and spread that word in the society. And if you, to make a simple statement, 85% of the cancers what we see are preventable. So these preventable cancers are our own reasons that we are developing more and more cancers. So we should be conscious about it, and we should take care of ourselves. Now, Ms. Swapna, so these days, as Ms. Christina was mentioning, the smoking has come down. Most often, when I visited the software companies and when I go there to give lectures, I've seen hundreds of girls standing outside the campus of the building and then smoking. So I've seen more girls smoking than the boys. So I'm sorry, correct me if I'm wrong. But several times I've
I
seen
would
that
chip
scene.
in and tell that suppose earlier 100 boys and 0 girls were smoking, the number would have probably come down to 40 boys or 30 boys plus 30 or 40 girls. So yes, it is true. It is happening. Probably it's a it's a probably time when girls are getting assertive, and this is a very wrong way of picking up the how to assert about things. Probably it is happening like that. Hopefully, with time will come down. The way it has come down in boys, this is really a very encouraging thing that smoking has really come down among the boys who are in college.
So as a CEO, what measures that you would like to take to do this? And yeah.
So yeah, I beg to differ though. I see equal number like he was saying of men and women smoking, and that has come down a lot because you're not allowed to smoke in public areas now. So that has really reduced the a number of times people would go out for a smoke or do anything as such, right? So that is really reduced. But what is happening is when you were talking about equality is we as girls have all even for our daughters, right? We always tell you're equal to men. You have to study equally. You have to probably study better. You probably have to work harder to get ahead of men. And unfortunately, the men are not told the same, right? And then what tends to happen is you grow up very differently with very different ideologies, and then the clash happens. So that's what I've seen or I've noticed.
So besides that, I've seen most of these girls are more focused on their career, less focused on the marital life, and these kind of problems, and no exercise. So that's about what are you going to do, whatever that you can do to get these people get more exercise, get into some kind of a sport, and then going for late marriages and not having children till 35, 36. All these are leading to malignancies.
Yeah.
So some kind of awareness you need to do, or repeated messages, or some kind of a workshop that you need to do among these girls who are working.
So I think what tends to happen is when we are asking our girls to be financially independent, your career clock and your biological clock are always at a clash, right? When I want to get married or when it's the right time to get married, that's when I'm done with my college and I have to start initiating my career and work really hard. At least in the initial stages of your career, you're expected to work really hard. And when you're actually supposed to have children is when it starts accelerating, right? And it's a clash, it's a biological clash. Unfortunately, what tends to happen is if you want to get ahead in career, you have to think about what is it or how can you balance, and that perhaps is leading to this. And I think a lot of corporates are doing a lot of things around this to see that we have returnship programs where we ask people to come back to work even after they've quit work post children. Right now there's a lot of sensitization that is happening across corporates. We are encouraging women to come back to work, we are encouraging them to have that work life balance, and probably that should ease out. So I think what we need to do is build that ecosystem at home and at office, right? You can't work as if you don't have a home to take care of, you can't take care of home as if you don't have a full-time job. But that's what is expected of out of women, and unfortunately that increases your risk, your stress, and everything else.
So
Yeah.
I remember my grandfather and my father telling me that everything has to be balanced. Everything has to happen at the right time and the right age.
Yeah.
There's nothing should be stopped for something to be finished. So then you're going to lose your life. So for me, scientifically, physiologically, the girl should get married between 22 to 25, and the first delivery has to be before 30 years. In
Yes.
every aspect, physically, mentally, psychologically, everything matters when they are having timely marriage and timely children. not just protecting. Please come on to that.
So I will just call her up onto the stage
Yeah,
too.
that's it.
So we are being joined by Dr. Ananta Shankar Jayant, Indian classical dancer, choreographer, and a Padma Shri awardee. Welcome, ma'am.
So right time, right things to happen. So at the age of, before the age of 25, these girls should get married, and before the age of 30, they should have the first child. To have in every aspect the feeling of well-being, good health, and preventing from major 5 illnesses. That is the right time to think. So I would again say, reinstate that the girls should not just focus on career; they should take care of themselves as well as their family to have a good, healthy life.
And the initial stages, if you do that, then you have the rest of your life to take care of your career
Absolutely,
as well.
absolutely. So, a question to you,
And
Ms. Ananda Shankar.
Sorry, I just want to reiterate one thing. I know it's a lot of things have been said about what women should do. I think a part of this happening is also men participating in the process. Unfortunately, we are not living in a time that was like how it was when our grandparents were there. There's a lot of pressures of living an urban life. There's a lot of pressures of financial pressures to survive. And kids are a very expensive, commitment to make. Both, and also bringing up these kids in a very balanced way. Are we going to be able to do it? Because sometimes bringing up a kid is just not giving birth to one, actually creating an environment that's really healthy. And for this, the home environment really matters, and there's a partnership that has to happen. And it's the community has to
Fatima, we are
support it.
diverting our discussion to
No,
some
but
other
I
thing.
want to make that
So,
very clear.
you understand. So, the question to you, and it's as a mother. So, what can a mother do to cultivate good habits in children and to take care of their spouse? I'm not saying that husband should not take care of a wife, but as a responsible woman, to cultivate good habits among children right from childhood. If they start doing it, they'll continue to grow in the same fashions.
Thank you, Dr. Reddy. At the outset, deep apologies for being late. I got caught in a crazy traffic. I think there's a lot of traffic on that side of the city, so apologies for that. Yes, so what is it that a family can do? What is it a mother can do? What is it that parents can do to give a rounded growth to the child? Is that the question? The holistic
Yes.
growth. So I come from the space that I have grown up in. I come from a middle class family, who very early my parents chose to provide me a training in the classical arts, and I think that has helped me transit through cancer. I've had a tryst with cancer, breast cancer, and you will ask me, how are these two connected? How is a training in Bharatanatyam helped me deal with breast cancer? Well, the simple answer to that is, while the clamor and clutter of cancer is constantly around us, and I'm sure you as doctors know that it comes with its own melodrama. Cancer comes with its own melodrama because it has treatment, it has a downside, physical, mental, psychological downside of the treatment itself, all the side effects, and to deal through it, to transit through it, to be able to go over it. What will help us is something else. While doctors and medicine do what they have to do, and they do a great job, what you will have to do as individuals and as family members is to be able to tap into something different, to be able to ride out this process of treatment, which has its own side effects. So not taking away from the treatment or from what it will give to you, which is necessary. What you as a family can do is to train your child not to be ready to receive cancer. We don't want cancer to come to anybody, but but we don't know that. It's not, we don't know whether it will come to you or not. So that's a big if. However, if from childhood, if you're able to train the child in something which could be, I call it a core strength. You're all core competent nurses, doctors, engineers, bureaucrats. But what we are also forgetting in our academic training is we don't give a core strength to the child. And that core strength, I believe, comes from one's talent, from one's unique talent, which if the parent is able to identify and nourish and cherish and train from early days, that will at some point of time, you may or may not make it a career, at some point of time in the event that a challenge comes to you, and if that challenge is cancer, this will help you ride it out. To me, that has been my learning, and that is what I would advise young parents, because today's young parents are so focused on chaduvu, 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 which is good. But after that, there's something else that me space. If that me space can be trained from childhood, I think it'll help in the transition, not just for in face of a challenge, but just in life itself. Makes you more rounded.
Wonderful. So besides that, if I may add, if you cultivate the habit of taking green salad, cultivate the habit of taking fruits, all kinds of vegetables which are naturally available, and cultivate the habit of taking vegetarian, more of vegetarian diet and less of non-vegetarian, they would continue to do that in their lifetime. They would love to take salad, and you cultivate the habit of doing some kind of exercise, getting into some form of sport right from childhood, the child would continue to do that in their lifetime. So this is very important for the parents to imbibe that habits right from childhood, so that by growing they would continue to do that. So finally, screening and awareness is very, very important. So in that regard, what government can take some initiatives to help to do the screening in our state of Telangana.
Thank you. Yes, it's very true that screening is critical, and in this regard, consciously focusing upon women, the government of Telangana has started this. It's called Arogya Mahila Clinic, and this is not just at a few select destinations. This is done across our state of Telangana, and this is launched during the International Women's Day in 2023. So it has recognized that yes, women, when they have to come together with the men, and we have a very general kind of a checkup happening, then obviously we tend to lose track of what could be the specialized needs of women, and we are aware that very high case incidences of breast cancer, then cervical cancers, and then you are having ovarian cancers, and these they require this presence of a women gynecologist. You require a different set of people who are available to make the women comfortable to get themselves checked up even in rural areas. So this has been a very novel initiative, and I think it's a very good one that has started all over Telangana, and it provides 8 packages of healthcare. And I think this is really percolated down to the grassroots level. It's not just an urban phenomenon. And the total number of cases that are coming to these Mahila clinics are quite commendable now. And it also covers, strangely enough, when this was being conceptualized, a lot of the districts gave their feedback as to what were the issues that women would raise when they came to these Mahila clinics. And these Mahila clinics, apart from raising the issues of, gynecological checkups and other such issues, they also talked about, weight management and the role of, menopausal, hormonal fluctuations, which, obviously was also, weighing heavily on the mind of women in rural areas. So even how to cope and how to deal with menopausal symptoms, that was also one of the issues that they deal with. And 372 primary health centers in our state run these Arogya Mahila clinics. And so far, I think we have had around 15 lakh screenings that were done. And this is a huge number, and this happens, on a regular basis. And now we're trying to scale it up so that, more number of women can be covered in these Arogya Mahila clinics. And the diagnostic symptoms is, I think, oral cancers, 19 of them have been detected so far, breast cancers, 94, and cervical cancers are 124. Which brings me, to a lot. Very frequently, we are asked about the, introduction of HPV vaccines for adolescent girls, and also, as an augmentation for this. But as we are all aware, or as most of the medical professionals here will be aware, the HPV cancer is as of now not widely available. It is still very highly priced. And we are waiting for the government of India to announce something in the respect of including it in the universal immunization schedule. Recently, during the Parliament session, the Honorable finance minister had indicated that they would encourage or they would promote the use of HPV. But to what regard and to what degree, we'd have to see. And I think there are two factors linked to this. One is obviously, the willingness and the awareness among the demographic that we're looking at, adults and girls. And the second would be, the availability of the vaccine at affordable prices to make it accessible. So I think this is something that we need to also, have a dialogue about, because healthcare that is not affordable is not accessible. And when we're looking at accessibility, I think this is one important thing that, the governments could work with the private sector on.
If I may add just a point that the first thing, I think if you haven't discussed it earlier, if I might have missed it, it's just that I think most of us as women put ourselves on the back burner, putting the family in front, ahead, putting children ahead. That if that mindset slowly and steadily through these training programs, that I think will be our first barrier. If we can break that, especially in the rural areas, I think we face that heavily, and I'm sure doctors are aware of it. ఇప్పుడు నాకెందుకులే, let the child, పిల్లలు చూసుకుందాము, పిల్లలు చదివిన తర్వాత మనం మా హెల్త్ చూసుకుందాము, that mindset is there. I think somewhere that if that changes, I think things will change.
Thank you very much.